Harper's Restaurant and Brew Pub reopened June 8, 2020 at 50% capacity after the initial closure of businesses due to the COVID-19 outbreak. By June 20, 2020, there were 100 positive COVID-19 cases traced to that location. Even though the bar followed capacity guidelines and table spacing, only a few of the patrons wore face masks for additional protection. Unfortunately, COVID 19 is not something that we can easily see and move away to avoid. After researching the subject for my speech and working in a hospital setting where I received briefings on the benefits of wearing face masks, I have come to the same conclusion as the experts that one of the best ways to help prevent the spread of COVID 19 is to wear face masks in community settings. Good afternoon. My name is Gerald Coleman, and I'm going to speak to you about how wearing a face mask can help reduce the spread of COVID 19 and other respiratory viruses when worn correctly and frequently. So I ask that you listen with an open mind when we discuss some of the problems of not wearing a mask and when you have been infected with the virus, when you have not been infected, and when someone has been infected but do not show any signs of that infection. COVID-19 virus transmits from person to person and happens easily without a mask. As of July 24th, 2020, the U.S. had over 4 million confirmed cases of COVID-19, and there were over 67,000 in Alabama, according to the Center for Disease Control. The death total from this virus is over 145,000 for the United States. The spread of this virus has been rapid and has outpaced efforts to slow its spread. The confirmed cases and deaths are alarming. This is a virus that can affect everyone. Older adults and people with underlying medical conditions such as cancer, COPD, and serious heart conditions are at increased risk. Evidence also shows that key transmissions of COVID-19 is viral droplets. These droplets fly out of your mouth when you speak, cough, or sneeze. As the droplets enter the air, they quickly evaporate into tiny particles and are inhaled by those who are close by. A sneeze travels even further, up to 6 feet. Now we've seen the extent of the problem, we can explore its causes. Causes of the problem is changing of guidance to prevent the spread. At the beginning of the outbreak, the initial guidance was only that those in high-risk categories needed to be concerned about the virus. Only those were required or advised to wear masks. And also, due to the shortage of the personal protective equipment, was a big issue as well, and limited supply of masks should be saved for healthcare workers. According to the CDC, another cause is that culturally, the U.S. was not prepared to wear masks. Wearing of masks in some countries, like Asia, was no issue because it's already a common practice. But in the U.S., it is mostly a seasonal and has not been a requirement to wear a mask for a long extended period of time, mostly during the flu seasons. So the extent of the problem and causes are clear. There are steps we can take to bring about a solution. The most important thing is to wear a mask in a community setting. Masks have been proven to reduce 99% of the droplets that can spread the COVID-19 virus, according to research done by the World Health Organization and the CDC. Wearing masks also helps limit the touching of one's face and mouth, nose and mouth. Detailed, it prevents a person who may be infected as well, especially one who does not show symptoms of the COVID-19 virus, from infecting others. Detailed contact tracing has shown that a large number are infected by those who show no symptoms. This is according to the CDC, and they place that percentage at 40%. This has led the CDC and the World Health Organization to recommend that wearing a mask is the best way to stop the spread and defeat COVID-19. Now, I know people have different reasons to wear or not to wear a mask. I ask that you do not wait until it affects someone close to you before deciding. We all have to go to work, grocery shopping, run errands, and in doing so, come in contact with people every day. Let us join in this fight against COVID-19 and put a mask on to stop the spread. Doing so will allow the nation to get back to normal. As I said earlier, wearing a mask may not be culturally normal, but doing so will save lives. Thank you.